Hello and welcome to another video in Foundations of Maternal and Newborn Health. In today's video, we're going to be talking about PlacentaPrevia. PlacentaPrevia. And so this is a disease where the placenta grows around the internal os, or around the cervix. So first we'll talk about the normal positioning of the placenta. So typically the placenta grows on the upper aspect of the uterus. So if this is the cervix down here, this would be the fundus of the uterus up here. And so typically the placenta will grow on the upper portion. So it can either be on the front or the back of the uterus. But typically the placenta is growing on the upper portion. We also see in normal development that the umbilical cord isn't wrapped around the baby or being compressed. It's just sitting freely. So in our first disease condition, we have a partial PlacentaPrevia. Partial PlacentaPrevia. And I can group this in with a low-lying placenta. Low-lying placenta. And in this other picture here, we have kind of a complete PlacentaPrevia. And regardless, either way, the placenta is growing over the internal os of the cervix. In the case of a low-lying placenta, usually the placenta will be close to, but not necessarily overlapping, the internal os of the cervix, but this would still be kind of a risk to look out for. This would be a placenta that would be at risk of being an issue during birth. So with the partial PlacentaPrevia, the low-lying PlacentaPrevia, this is typically identified by ultrasound. And usually you'll identify by ultrasound, and then you'll do a follow-up transvaginal ultrasound. And so basically what they're looking for is whether the placenta is close to or overlapping the internal os of the cervix. And so even at 28 weeks or 32 weeks, the placenta can be close to the internal os of the cervix, but the placenta can actually move over time. And so even if the placenta is close to the cervix at 28 or 32 weeks, you can do even a follow-up transvaginal ultrasound at 36 weeks. And if the placenta has gotten far enough away from the cervix, then it would just be considered a normal pregnancy. So really, we're looking for kind of at-risk placentas and then following them until basically we can't give it any more time to move out of the way, and then it has to be dealt with by C-section. So that brings us to our next point, which is management. In the management, PlacentaPrevia is just a C-section. So an elective C-section. If the placenta is sitting on top of the cervix, the risk is postpartum hemorrhage. As soon as the membranes rupture, and the placenta will then start peeling off of the cervix and start to bleed, and this would be the baby's blood that's coming out, and so this would very quickly lead to fetal demise or fetal death. So the management is to do an elective C-section, remove the baby, and then pull out the placenta if possible. So another big risk factor to PlacentaPrevia is the co-risk associated with PAS disorders. And so we talked about PAS, or placenta accreta spectrum disorders, in the previous video. This is when the placenta grows too far into the uterus, or even through the uterus. And so typically people with PlacentaPrevia are at higher risk of developing PAS disorders. And so we're just going to talk a little bit about the mechanism of PlacentaPrevia, and hopefully that will make more sense as to why there's a higher risk for developing PAS disorders. So the placenta is at higher risk of developing along a scar in the uterus, and modern C-sections are done using what's known as a fan and steel incision. And so this is when the OBGYN will cut the uterus down near the pubis symphysis, or down around the hips. And so the uterus is cut just at the lowest part of the uterus. And we spoke about this in the uterine anatomy video, but the fundus of the uterus up at the top is the strongest part of the uterus. It's got the biggest muscle, and it allows pressure on the baby from the back so that it can be pushed out towards the cervix. And so when these fan and steel incisions are done, they're very beneficial, because if you have VBAC deliveries or any future pregnancies after cesarean section, you're not compromising the fundus, or the strongest part of the uterus. You're just compromising the thin, kind of weaker aspect of the uterus in the front. It also leaves a more desirable scar as well. It's not kind of down the middle of your body. So that actually brings us to the next type of incision, which is a classical incision. And that's where they cut the uterus straight down from top to bottom. So this would be a classical incision. And there are still instances where classical incisions are still used, but it's very, very rare. Only in emergency situations would you really do a classical incision. The downside about the fan and steel incision, however, is that now you have a scar developed in the uterus at the bottom of the uterus. And because we know that the placenta can sometimes grow into these scarred areas, it promotes the placenta to embed very low into the uterus to create either a low-lying placenta or full-blown PlacentaPrevia. We also know from our previous video that placentas that have embedded into scar tissue of the uterus are at higher risk of developing PAS disorders, because the uterus is now compromised in that area and lacks the cells to tell the placenta to stop growing. And so in patients with previous C-sections, you're at higher risk of developing PlacentaPrevia as well as PAS disorders. So previous C-sections. So just as a point of reference, PlacentaPrevia happens in about 0.5% of deliveries. So this is about 1 in every 200 births. And we didn't talk about this, but PAS disorders occurs in approximately 1 in every 1,000 births. So this is the same as 0.1% of births. But if you have developed PlacentaPrevia, 11% of women who have PlacentaPrevia, so this 1 in every 200 births, has an 11% chance of developing, or 11% of people with PlacentaPrevia developed a PAS disorder. And so that increases the need for a C-section and also the risk of potential hysterectomy. So the last thing that I wanted to touch on is actually a slightly different disease, but is also a side effect of PlacentaPrevia, is VASaPrevia. VASaPrevia. And VASaPrevia is thought to be caused by low-lying placenta or PlacentaPrevia. So you have a low-lying placenta, but this placenta migrates back up over the course of the pregnancy, and so the woman doesn't necessarily have to have PlacentaPrevia, but what happens is the umbilical cord remains sitting over the internal os of the cervix. And so when the membranes rupture, the baby's head drops into the vessels of the umbilical cord, and they're at risk of rupturing. And again, like PlacentaPrevia, if these vessels break open, if these vessels rupture, it's spilling fetal blood, and very quickly the baby will lose enough blood to die. So VASaPrevia is also very lethal to the baby, and is also identified by transvaginal ultrasound. So again, this is transvaginal. And so they do an ultrasound through the vagina to identify either umbilical vessels or a full placenta sitting at the cervix.